is getting worse. Or that in another poll, 61% said recent price increases had caused financial hardship for them or their household. And Mr. President, let's be very clear. This is not a random situation that just happened to occur on the President's watch. The President bears direct responsibility for this inflation crisis, which was—
money do you need to actually implement the plan? I too am a little troubled by some of the political rhetoric around the IRS, given particularly the checkered history of the IRS and targeting certain taxpayers that you're all too familiar with as a result of your coming in after the Lois Lerner affair and the targeting of certain taxpayers. But the President said we're not going to collect taxes from people making under $400,000 a year. Actually, he didn't.
Was released. And although the future for the Social Security benefits are in jeopardy, some lawmakers are not looking to save Americans' hard-earned benefits, but give recipients an additional $200 per month. Introduced by Democratic Representatives Peter DeFazio and Bernie Sanders, this expansion act for Social Security will give beneficiaries 12% more each month, which is $200 a month or around $2,400 stimulus checks. The bill would boost benefits for some earners currently earning above $147,000 are not subjected to Social Security taxes, but the bill would change it so all earnings at or above $250,000 are taxed. Lawmakers said more than 90% of households will not see a change in how their income is taxed and will not be raised. It's projected that Americans will stop receiving their full Social Security benefits in 2035 if the lawmakers don't act, according to a report released by Social Security and Medicare trustees. Folks, the massive climate change and healthcare bill was finally passed by Democrats this past weekend. IRS is set to receive nearly $80 billion through this act, and the agency has the means to develop the new systems to help Americans pay their taxes. However, several hurdles stand in the way. There's also pushback from commercial tax preparation companies, which question whether Americans want the IRS to prepare their taxes. This is another bill that includes a provision that allocates $15 million to the IRS to make plans for a free, direct e-file tax return system. Those plans would have also to be developed within 9 months and will be included in the cost estimates for creating and administering a system. They would also require public input, and so far, Senate Democrat Elizabeth Warren resubmitted a bill called the Tax Filing Simplification Act. It would require the IRS to create its own free online tax filing service and move away its partnership with private tax preparation companies. Warren told reporters Americans spend too much money to file the taxes. Spend too much time and money to file their taxes. The IRS should adopt these proposals to help millions of people file taxes and claim refunds.
Supports extension. We would love to see Congress enact that. It's made a huge difference to inequality. It was a very important initiative. I feel very proud. I appreciate your comments. I feel very proud of the work that Treasury and particularly the IRS was able to do to get this money out and to do everything we possibly could to ensure that non-filers.
We have bad news. This year's big COLA increase in Social Security monthly benefits is falling short for the millions of people that are relying on these payments. And that's because for the past 2 months, the biggest increase in Social Security benefits has been for decades been delivering much needed breathing room. Much needed breathing room for the past couple of months for the seniors, because nearly all of the survey respondents of a Social Security poll say that they don't think this year's sizable bump will give them a chance to get their feet on the ground again and catch up. So that's not good. Furthermore, they worry that the increased income could result in huge tax bills. This year's beefed up COLA, which boosted the average retiree benefit by more than $140 a month, will push retirees over the edge, over the income thresholds which are not indexed for inflation, plus thus requiring them to pay more taxes on part of their Social Security benefit. Many who had not paid taxes on their benefits in the past are going to have to go through this. With that being said, a Social Security policy analyst has told Yahoo Finance that even as inflation moderates, it will be more difficult for lower and modest income seniors and those who have been retired to dig out of the shortfall between what Social Security beneficiaries received over the past 2 years. And this effect of actual inflation is going to not be good, because according to the SSI, nearly 9 out of 10 people aged 65 and older receive Social Security benefits. Among the elderly Social Security beneficiaries, 12% of men and 15% of women are on Social Security for 90% of their income. For the typical retiree, it covers about half the retirement income. Seniors overall have been feeling the gap for months now. Last fall, nearly 2 out of 5 of the 1,500 retirees had this problem. The Senior Citizens League reported that their standard of living had worsened since March 2020, and they had depleted savings faster than planned. Roughly the same percentage that they had no savings and had piled on debt and had tackled low-income assistance programs. So when the Social Security Administration, the federal government agency that oversees the benefit, announced the increase for this year, the largest since 1980, when the COLA was 11%, there was a resounding echo of applause. And that's because it raised the average type benefit by more than $140 a month. Even the adjustment, coupled with a decrease in Medicare Part B premiums, was expected to make a significant difference in making ends meet for more than 70 million senior citizens. The expansion would be financed by consolidating other tax benefits, including a significant revamp of the Earned Income Tax Credit. The Center on Budget and Policy Priorities estimates the number of children living in poverty would decline by 1 million under the Romney proposal, and the roughly 20 million children families making less than $50,000 would be better off by this. Analysts have also argued that roughly 10 million people will be worse off under the Romney plan, due in part to its proposed cuts. So, hopefully President Biden can do something about this. We got some bad news. Some really big changes are actually coming to monthly benefits soon. Officials have always confirmed that millions of Americans are at risk of losing health insurance in just a few weeks, and very important details have been announced. So be sure to keep watching because we got a ton of information about the fourth stimulus check, Social Security benefits, SSI, and SSDI. You definitely don't want to miss out on this because there's a ton of information that we got. So, like I said, the Biden administration is telling healthcare providers to begin preparing for an end to the public crisis emergency. The change will have broad implications for Medicaid health insurance recipients, and it could significantly impact how hospitals and pharmaceuticals operate. The health secretary told reporters on a call that how the United States manages this crisis will provide crucial data on whether the emergency needs to remain in place. The Health and Human Services Department will give the public 60 days notice before lifting the crisis emergency. His comments come after President Biden claimed in September that the crisis is over. The Centers for Medicare and Medicaid Services told healthcare providers in August to start preparing for a return to pre-crisis rules as soon as possible. The crisis emergency was first declared by the former president in January 2020, and the health emergency has allowed millions of people to receive increased food benefits through the federal government nutrition program. And when the public health emergency does end, the Health and Human Services Department estimates up to 15 million people will be disenrolled from Medicare and health insurance programs. Nutrition experts fear that millions of families will face a hunger cliff. The most dramatic impact from ending the health emergency will fall on people enrolled in Medicaid and the children's